But it's also, I think, why I love my job, because my patients in and of themselves are innocent of their disease. And so I think that there's a purity in that makes it a little easier. And I think it's, a lot of what that is it forces me to be creative.
Welcome to the Build Beyond podcast, where we challenge and guide so that you can meet your full potential. Yeah, I really want to pick your brain about youth physical fitness, especially within a pediatric population. But I also want to take some time to introduce you because some of the listeners may not be in the local area, may not know you. So for anyone who's listening, this is Dr. Nichole Ellis. She is the pediatrician for my two children, and we go together to the same CrossFit gym. So we know each other quite well. But and you're also the chief of staff at the hospital, right?
I am.
I think it's an interesting story. How did you become a pediatrician?
Yeah, so there's like a lot of twists and turns that went with that. I actually went to undergrad and enjoyed medicine, but I actually was looking more into epidemiology, and that was kind of where my passion was. I worked at a free clinic while I was in Kirksville, which happens to be the very first DL school, and I think that's why I have maybe such a high affinity and regard for chiropractic medicine, because there's so many similarities in that with the osteopathic and the chiropractic. I think go really hand in hand very well in kind of just treating the whole person. But got exposed to that while I was helping out with a free clinic and decided to do medicine instead of epidemiology. And then I thought I was going to do family practice and emergency medicine. And I came to our town in Hillsdale for a rotation, and thinking that it was going to help support that family practice emergency medicine pathway, and fell in love with the town. And so I called my boyfriend, my husband, who was my boyfriend at the time, and said, well, if you want to be where I am, you should probably come and check it out, because I love this town. And this is where I want to raise my family. And so he came. He loved it too. We kind of both knew, being from Kirksville, and then him with, growing up in small towns, knew what we were getting into. And then just loved it. Loved it 2 days into pediatrics, and had great mentors all throughout. I took over and had mentorship with a physician that was here for 40 years. So it's just been great.
Nice. You do some other stuff at the hospital though, because when our second child was born, you popped up out of nowhere. So I know you go in and you see the newborns, which is not necessarily what every pediatrician gets to do. Can you talk about that a little bit?
Yeah, so I do a lot. There's a lot of community-based healthcare that goes into being in a small town in rural medicine. I think for me that's really nice, because I never get bored, right? I never bored. And so I do some care with pediatrics in the emergency room if they need me. I help out with newborns if I'm needed, or just around and make sure that the newborns that are born here are healthy. And then I have my own practice that I take care of my own patients that are within this community and the communities around. And then I think there's an additional responsibility, just because I am the only pediatrician in the county, so there's not a whole lot of backup to share that load. I'm lucky we have some really incredible family practice docs and advanced practice providers that also take care of children very well too. So it's not just me, but yeah, from a pediatric standpoint, it is.
Okay, that's interesting.
Mm-hmm.
So we'll shift a little bit to physical fitness. So for the listeners, we both have kids, and both of our kids recently participated in CrossFit Kids.
Yeah.
Although your kids are a little bit older than mine. Connor's almost 5, so he was definitely the youngest one in that group. But I've been involved with CrossFit on and off for quite some time, but I'd never participated in any CrossFit Kids stuff. I'd never coached it. obviously I'd never had kids before that could participate in it. So I got to watch my 4-year-old running around doing a bunch of burpees and having fun with some older kids. And he loved it. And he did really, really well. And I think there's maybe some apprehension out there for adults not wanting to get into CrossFit. And then I think some people can't even fathom what that would look like for kids. But as a physician, a pediatrician, a CrossFitter, a mom who puts her kids in CrossFit Kids, what do you think about that program as far as development of skills and health?
Yeah, I think what's really nice about CrossFit is how customizable it is across generations. So you brought up our children are different ages. So I have teenagers and preteens, and you have small young children. The idea of CrossFit is not necessarily to complete a certain weight or bench a certain amount or do a certain amount of burpees, but just to increase individual strength and well-being. And I think that is very nice. I think what your son gets out of it versus what my daughter gets out of it is different, not less or more, but maybe more apt for play or speed or just enjoyment and moving our bodies, which are so healthy for our children's minds and bodies and spirits. And then as they get older, I think that we can really see when they're committed to a sport and they want to excel in that sport, how having cross-training improves their sports performance, but also helps with reduction of injury and reduction in burnout, all of those really wonderful things that you kind of get into when you have kids that are kind of becoming more and more specialized in one maybe sport.
Okay. So have you seen, because your kids are a little bit older and they're playing competitive sports, have you noticed the difference between, I don't know at what point they started doing CrossFit Kids and if you could tell a difference in sport performance?
Yeah. So after doing the CrossFit, I think my daughter had done junior high. The first time that she went out to participate in in the sports, came back, oh, I'm so sore. Something is wrong with me. I think I've hurt myself. And I'm like, oh no, honey, that's just sore muscles, like that's it. And so then when the summer came around, she's like, no, I'm doing this. I'm going to take part in these workouts. I'm going to work on my strength. I'm going to work on my, agility and my endurance. And so then when the next season came up, she goes, I hung in there and I was better. I was stronger. My serves were better. I'm not as sore when I'm participating in activities. And so I think that was where she saw that. And then I think, my son sees gains in speed and endurance too as he's playing CrossFit or playing soccer and his sports and basketball.
Okay.
Yeah.
Well, good. Yeah, Connor, he's a little bit different. He thinks as a 4-year-old, he literally thinks he's the strongest person. So but when he interacts, obviously everyone's stronger than him, but he won't admit that.
Yes.
So for him, it was a little frustrating because it was confronted with the fact that he was not fast compared to kids twice his size. But when Matt started playing some of the games and made it fun, he got into it and he started goofing around and sprinting and everything. So the play aspect for Connor was huge. And he really loved it.
Yeah.
But he was sore.
Yes.
And he didn't, it's hard to explain to a 4-year-old. He thought it was like, my legs hurt so much. I'm like, you're fine. Just eat some more chicken nuggets. You'll recover. Just watch it,
That's right. Yeah.
Well, have you noticed any trends as a pediatrician in physical fitness or physical activity for kids?
Yeah, I think that there is a frustrating divide. I think that you have children that may be really talented in a sport electronically and then get frustrated when that does not manifest in the real world. Right? And so I'm seeing that greater divide. And so you have some kids that are you have one end of the spectrum where they're kind of over exposed to a sport, overdoing it in one particular sport, which we have plenty of medical evidence that is not in children's best interests from an injury and burnout standpoint. And then you have the other ones on the other end of the spectrum that probably could not make the team or participate in a team in a meaningful way. I think the other nice thing about CrossFit is that you can take both of those people and get them started with physical fitness and have it be where they are at that current time, and that no one is expected to be, we have a few really incredible athletes in our gym, and my expectation is not that I meet that standard of being able to compete nationally, but just to be stronger than I was the day before. Or there's just days where I'm not feeling very strong at all, and I'm doing the best that I can in that day. And I think that part is really important, and that mindset is really important, not only for adults but for kids. That the act of moving, the act of doing something for your body has positive impact, and I think that teaches them a lot. And I think they're missing out on that, especially if it doesn't come easy. And that you're making these small investments, and some days you have gains and some days you may have a PR, and then other days you don't, and that's still okay because you're moving your body and you're doing something good for yourself. And I think that's the biggest thing that we're missing out on, is that like instant gratification with regards to physical activity or sports, that there needs to be more, and that you have to recognize that there are smaller gains that you may not see each and every day.
Okay.
I don't know if that makes sense.
It does. Yeah. I think, if you spent any time in sport or in the gym, that makes a lot of sense. But there's a lot of people out there who literally training age of 0, never played sports, don't go to the gym, and now they have kids. And and we have a lot of homeschooling at least around in this area. And so I'll see it when kids come to college and they'll end up in the health center, and I'll be asking them, and like, well, I've been homeschooled my whole life. I've never played an organized sport. I've never been to the gym. I've never had PE class. I have, and then they literally are, 18 to 20 years old, and they don't know what to do. And it's not that they haven't played before, but there's been no instruction. So how do you, as a pediatrician, if you have one of those parents in your office, I'm sure you have these conversations. How do you deal with that?
Well, I really try to, for those kids that are potentially easily frustrated or kind of brand new, try to pick something that will cross train, or will be easy enough for them to adopt at early stages, but then has benefit into other areas. So like martial arts or swimming or dance or gymnastics or CrossFit, where the kind of the stress or anxiety of trying out is not there, and that gets them into a certain level of activity. The other thing that I think is really important, maybe not for the 18-year-olds, but for younger, is to encourage parents to be a part of that, right? Children learn through modeling. And if parents are putting a stress, like a healthy level of stress and importance on an activity, and they're willing to partake in that, and they're putting their health first, then children will be more likely to do that as well. So we see that that trend goes both ways. So children who have one obese parent are 1/3 more likely to be obese themselves. If they have 2 parents that are obese, then that number over doubles. So
that seems to be a impossible cycle to break for some people, because it's like there's so many things you have to change. You know what I mean? If you come from a family with obesity in the family and you've been struggling with it, and then all of a sudden you have a family and you have kids.
Yes.
And you see them kind of trending in that direction.
Definitely.
I don't know. I when I talk to patients, that there is that almost some level of hopelessness.
Mm-hmm.
I'm at and I feel for them. And it's that sometimes taking that first step is so difficult. But I
Mm-hmm.
like what you said about just, go swimming or go do something, go play,
Mm-hmm.
and then just see where it leads as long as you're doing something. Because I feel like there's this level of perfectionism also with a lot
Mm-hmm.
of people where if I'm not doing the perfect thing right, then what's the point? And it's
Yeah.
like, there is still a point if you just have to move, there's no perfect movement.
Mm-hmm.
So
I also think too, I did my fault. I brought up this term obesity, which I think is not helpful. Maybe from an individual standpoint, I think from a public health, I think it is a public health important tool. But I do not think terminology like that is helpful on an individual level. And, making sure that everybody has the right attitude or the right goal, that the goal does not have to be weight loss. The goal does not have to be you look like Taylor Swift. The goal is that you're moving your body, that you are trying to make good, healthy food choices with good fuel, more foods that are grown on the ground or raised in the ground, and more time doing movement, especially movement outside, in a way to keep your body healthy. And if you're doing that, the focus shouldn't be on the scale, but on small little gains that you have.
Well, how important is it, in your opinion, to be physically active? Can someone be sedentary and truly be healthy, in your opinion?
I think that you cannot be sedentary and be healthy. I think that you can be quote unquote obese and be very healthy. And so that is it. You can be skinny and sit on the couch and have problems with long-term risk of heart disease far more than someone who sits higher on that chart but is moving every day and eating good nutritious food, but genetically maybe just predisposed to a higher weight. So I do think that mentally, like mental health, physical health, is so closely intertwined with movement.
I agree. Yeah, I think, BMI only tells you so much, and
Mm-hmm.
it doesn't really tell you a lot, to be honest.
Mm-hmm.
But if you can stack it up, I mean, obviously if someone's got a very high BMI and they've got high blood pressure, and then you start to
Mm-hmm.
like, there's a bunch of stuff going on, you go, okay, well,
Mm-hmm.
we got to look at all the evidence and say we're not going in the right direction.
Mm-hmm.
But I think some people, they get hyper focused on the body weight when it's like this. Yeah, it's important, but it's not the whole picture. But I think people go into exercise thinking they're going to lose weight, which is actually counter to
Mm-hmm.
the evidence. I know that's something we always think of, but you can't
Mm-hmm.
exercise your way to weight loss. And that has
Yeah.
been proven and demonstrated over and over
Mm-hmm.
again at this point. I just don't think it's maybe hit the mainstream common knowledge.
Yes.
But it's hard to be healthy without movement.
Mm-hmm.
So, I mean, I would say it's almost impossible. I
Mm-hmm.
would agree. I tend to agree with you. If you can't move your body how you need to move it when you need to move it, I don't know how you can be, I don't know how you can actually call yourself a healthy person. But if you're slightly overweight
Yeah.
and you're moving well and everything else is good, it doesn't seem to have, for a lot of people, as much effect as non-movement does.
Mm-hmm.
And we see it at the college a lot
Yeah.
because we have a lot of highly intellectual people who put a
Mm-hmm.
lot of effort into academics. They
Mm-hmm.
sit a lot.
Yeah.
And if you looked at them, they don't look unhealthy,
Mm-hmm.
but there's a lot being left on the table that they're leaving a lot of their health potential unrealized
Mm-hmm.
because of the lack of movement.
Mm-hmm.
So,
Yeah.
well, for kids,
Mm-hmm.
a lot of people aren't going to just necessarily go take their kid to CrossFit or get them a weight set or do any of that.
Mm-hmm.
And they can go play and all those things. But what if someone's kind of in between? They say, okay, I get my kids out and playing a lot more. I'm thinking about getting them into some resistance training, but I'm worried
Mm-hmm.
about injuries. is it actually healthy for kids to go out there and put stress on their joints, especially they have open growth plates and they're should they be trying to put on muscle mass or get stronger? What do you think?
Yeah, so obviously technique is important. And poor technique can lead to injury, and we certainly don't. We want to create, especially when we're first learning different movements, that it is far more important to do that correctly, right? I think I'm sure this is attributed to someone, but far more important to do one high quality sit up than 100 poor ones. And I think that muscle mass is important, but working on body mechanics and good body mechanics, even without weight, like you can get a good workout with just, filling potentially a backpack full of books and keeping it evenly on your back and working on squats and squatting in and out of a chair, or doing wall sits, or doing resistant bands and wall sits. I do this a lot, with female athletes and young female athletes, because especially with basketball, knee injuries are very common. It has a lot to do with the carrying angle of the hips in a female athlete that puts undue stress on the ligaments and the support structures of the knee. And so we spend a lot of time at physicals talking about how to do a concept called neuromuscular training. Like, how do you get into a deep squat or a wall sit and then have someone offer external or internal pressures, first evenly and then unevenly, and then maintaining that stability, and how important that is. That doesn't need a fancy gym. It doesn't need a CrossFit membership. It's, I show them a couple of videos on my phone and work through them, but a lot of physicians hopefully should be able to kind of walk someone through that at a routine physical. There are some videos that you can find online that talks about proper mechanics, and then you can do those again with just equipment that you have at home. It doesn't even have to be a full decked out gym in your garage. You can do that body, learning how to do burpees, learning how to do push-ups. I think they talked about, there is a study out that talks about the ability for grown men to do 10 push-ups means that their cardiovascular risk is like dropped by half. Like, just things things of that nature. You might have to double check or cross check or fact check that statistic, but it is something very low. And the ability to do that many push-ups in a 40 to 50-year-old man means that they have a statistically less likelihood of having heart disease. So that doesn't need any weight either. And you're building up resistance, strength, core strength, upper body. There's a lot of benefit there.
Yeah, I've never read that one, but I saw something recently about grip strength, which was actually even the research team was suggesting that it's even a better predictor of all-cause mortality than blood pressure and systolic blood pressure. So I don't know, I don't know if I necessarily agree with that, but even if it's close, having a stronger grip, and they're saying it's not the grip strength in itself, it's just everything that you would do to increase grip strength, because you're picking up heavy things presumably, and you're more active, because you can't be inactive unless you're going to sit there with a stress ball and just try and game the game and be sedentary but most people don't do that. So they also showed, I think the study showed that people with more grip strength generally had better diets, which makes sense. So it's like, people who have stronger grip are picking up heavy things and they're building muscle more efficiently because they're eating better. That shouldn't surprise anyone. So the thought is that like all of those things leading up to increased grip strength are actually what's giving you the benefit, which I would imagine is probably something to do with push-ups. If you're knocking out push-ups every day,
push-ups or pull-ups or playing, monkey bars. Maybe my orthopedic counterparts would disagree, because monkey bars lead to a lot of elbow fractures. But like monkey bars, playing and being able to hold your body weight and swing and or do a chin up or a pull up, on a playground. That's standard playground equipment. Being able to do that, playing outside, that's, helps build that too.
Yeah, I feel like we're starting to lose that a little bit. When we were a couple summers ago, we were back in Austria, visiting Marissa's family, and Austrian playgrounds, in comparison to American playgrounds, look like death traps. It's crazy. I mean, they're like, you think of like American Ninja Warrior type thing with little kids running around shoeless, and the parents are usually sitting there because there'll be like a place where you can get beer. So parents will be over there drinking, and the kids are doing crazy things on unsupervised. But it's just a different thought process with child play, where they haven't culturally they don't have the safety nets like we do here, which is interesting. Because I know Connor was apprehensive, like, I'm allowed to do this without you around. I'm like, yeah, I guess so. It's what the other kids are doing. So
when I think too, culturally, that is something that is built up at a young age. So they have more body awareness, they have greater strength at a young age. So there's just less need because they've kind of grown up that way. I also think that we need to let kids do somewhat dangerous things. Like if we're constantly trying to guard them from injury, how are they learning? If you're never taking off the training wheels, then they never learn the balance to ride the bike, And so there's some of that where you're kind of like pushing there with the knowledge that they may fall. You may scrape your elbow or your knee, but we'll fix it and then you go on. That was the conversation when I had apprehensive children learning to ride their bikes. And I said, look, this is your freedom. Like, this is you being able to go and have a sweet treat downtown, or go ride to your friend's house. Like, so learning to do this gives you a certain amount of autonomy, and you're going to really like that. You're going to really appreciate that. So having that autonomy, having the safety to fail or fall, and learning to pick up, I think is a big part of that. And I think those types of playgrounds really kind of foster that belief system.
Okay. You seem to know more about physical fitness than any physician I've ever met. Is that something that you guys got in med school where you went, or is it just a passion of yours?
It's a passion. I think with the epidemiology background, I just got really sick of kind of just regurgitating the same things that we were saying and watching things continue to fail. Like, we're just like, oh, eat less, exercise more. Like, well, there's more to it than that. Like, there's more to health. There's more to well-being. We are more than just, this, skin and bones. Like, there's more to us, and looking at what makes us really thrive. And I think pediatrics is nice in that way, because we not only think about keeping our patients healthy in the here and now, but I know that what I do has an impact, hopefully, on how they are as adults. And so making sure that they're a part of that, a part of feeling like they're in charge of how they're getting healthcare, how they interact with others. And so kind of looking at it from that point of view, wanting to be my healthiest, wanting to make sure that there was integrity in what I was telling my patients to do, that I'm not telling them to, exercise and or keep their bodies healthy while I'm binge watching the, I don't know, latest Downton Abbey or whatever the show is, at the time that I'm practicing what I'm preaching, and that I would be able to show that as well.
Okay. Do you think it's needed in med school? I don't even know if you could cram it in.
No, but it's like this idea of, you talk about like physician burnout and how you're seeing it more and more. A lot of it just, I would imagine, feels like you're just not getting fulfilled by just Band-Aid, creating Band-Aids for people. Oh, well, you have hypertension, take this pill. You have, diabetes, take this pill. Oh, that pill's not working, let's try this one. And so you're not really, none of those medicines are fixing, I mean, they're fixing a downstream problem, right? They're fixing the result of lifestyles that lead to that, right? But they're not actually, thinking of problems from an upstream, like what caused the hypertension? Let's work on that. Let's work on optimizing you so that you feel like you're truly thriving and not downing 10 to 15 pills that are just keeping you at the status quo, right? Like that doesn't make you feel better. That doesn't make you live your best life. It's just bringing your blood pressure down. And it turns out that if you go on a walk and, you substitute some higher sugary drinks for water instead, that you'll feel really good. And if you make that choice over and over again, you might feel good enough to not need those meds.
Yeah. That's interesting because the frustration that you just expressed, I feel the same way in chiropractic care. Instead of the Band-Aid and the medication, we're cracking backs, which it's useful. I mean, it does make people feel better. It's really safe, despite I think I'm not on the side of the fence where I think joint manipulation is at all dangerous. It's actually safer than a lot of other treatments, but it does become a Band-Aid where people have, I love the term you used, the downstream problem, because, someone comes in and they're like, well, I've got chronic episodic low back pain.
Yeah.
And it's like, okay, well, we look at it like you're not getting enough protein, you're not eating any fiber, you're dehydrated, you're overweight, and that's probably because you're over consuming calories. So we got to get, we're talking about nutrition. You're not sleeping well. You said you're really stressed out. You're dealing with depression. You've got some other signs and symptoms of something medical going on that you're afraid to ask your doctor about. There's all these different things that are going on in your life. And it's like, yeah, I can put that manual therapy Band-Aid on, and I guarantee that I feel like I can make you feel better. But in a weird way, I almost feel like I'm stealing something from people if I do that. I mean, I'm happy to do it, and I know that's what people pay for, but it's like, if I apply that Band-Aid too much and we don't have that conversation, I kind of feel like I'm taking by taking that pain away too much or doing it too effectively, applying too many Band-Aids, that pain can actually be a motivator in a way, and we can maybe have some conversations about things that can be done lifestyle wise. But obviously the things I deal with are not fatal. But you have, as a physician, I mean, people are coming to you all the time, I'm sure, with things that may not be fatal, but it's like, whoa, that's an infectious disease that we do not want to get out of control. So I imagine it's even more challenging for you because sometimes you have to apply that Band-Aid or whatever. I mean, it has to be done. We got to take care of this now. But how do you then, what do you do to try and make people understand, okay, we've got this under control, whatever it is.
Yes.
But we didn't fix it. Even though it feels better, it looks better, you think you're better, we have to make some changes.
Yeah.
How do you even start that conversation as a physician?
That's a conversation that we have at the get-go. So I clearly identify that we have two problems here. We have your acute problem, which we need to fix because you need to feel better, and we can't do anything else until we do that. But then we have the bigger picture problem in what are we doing to fix the bigger picture problem, and truly identifying it as that. For instance, you brought up kind of like pain or things of that nature, and oh well, I have this pain, it's impeding me from activity, or ankles are a great analogy. So I have this acute injury of my ankle, right? And so then I'm very clear, you have this acute injury of your ankle, and we want your ankle to feel better. So there's some things that I'm going to do to help you to feel better with regards to your ankle. We'll try some immobilization so that you can go to school. And we're going to do some anti-inflammatories like ibuprofen and ice to manage pain. Okay, and that's going to fix the problem of the most recent injury, right? But we also have to look at this as how the injury happened. and what caused the injury to happen, and how do we prevent this injury in the future, right? And you'll hear plenty of people say, oh, well, I have bad ankles. I had one bad sprain back when I was in high school, and I've never had good ankles since. Well, that's not a thing, right? Like, I mean, it is a thing for many people, but it doesn't have to be. And so then we talk about, okay, I'm giving you this immobilizer for school so you can participate in walking from class to class. Then as soon as you get home, you have to work on range of motion and resistance bands and step on as long as mom's couch cushions aren't white, step on a couch cushion and work on balancing and uneven planes and working on building up that neuromuscular strength and those little bitty muscles that sit between our bones and those nerves that kind of tell us where we are in space and how they correct, so that this is a one-time injury, not a repetitive injury. And so looking at both of those things in that way at the same time, doing those pathways at the same time.
But you have a harder job too, as a pediatrician, I would imagine, because you're not talking to one patient.
No.
You're talking to two people. So either the kid doesn't want to do it, or the kid would do it, but the parent doesn't want to supervise that it gets done. So, at least for me, I mostly deal with adults or grown kids. And I can tell by the look on their face, like either it's going to happen or it's not going to happen.
Yeah.
But I got to imagine it's more challenging when you're talking to two people of very different ages.
It is. That part is hard. Getting motivating parents to be active participants sometimes is the hardest, most frustrating part of my job. But it's also, I think, why I love my job, because my patients in and of themselves are innocent of their disease. And so I think that there's a purity in that makes it a little easier. And I think it's, a lot of what that is it forces me to be creative. And if I am going to be any good at this, with, my epidemiology and health education background, I should be able to meet someone where they are and walk them through that process. No matter, like, whatever small step and whatever carrot we have to kind of initiate that, understand that there are barriers that I may never know, or frustrations that I never know. I'm not going home with them and I can't raise them. So we've got to figure out how to help those parents too. You've got some parents, in our offices that get, just a small handful of days off, and they are working sometimes 6 or 7 days a week, full shifts, and they're taking off to come to a doctor's appointment, talking about play 3 to 4 hours, a week for kids is not very feasible for their family, just because they've got to work. And if they don't work, then they don't have food on the table, so things like that I get sometimes are hard. There's barriers that I don't understand. And so I try to kind of, again, meet people where they are.
That's a good point. I was listening, maybe a couple of years ago, I was listening to a podcast episode. It was two MDs talking, and one of them, I think it was at the time, was working in an emergency room, and they were discussing how difficult it is when you only have limited time with a patient, but also talking about, like, I got to address the downstream problems, to use your terminology. But, you start to see someone in the hospital consistently over and over again over the years. You want to have these conversations, and they were talking about how to communicate, like how in a very short period of time can you get someone to make a change. And they brought up the concept of motivational interviewing, which I had never heard of before. And over the past couple of years, I've become like an informal student of it, and it's changed the way that I think about patient care. Because I know you and I have had conversations about this offline before, about how there shouldn't be any such thing as as a patient who's non-compliant.
Yes.
It's just like, if a patient's not doing what they're supposed to be doing, who said they're supposed to be doing it? And did you make a plan with them, or did you just give them a plan?
Yes.
Maybe they're non-compliant because because it's your fault. Like, I'm not a good communicator, or, so the idea that, you want to meet them where they're at, I think it's somewhat unique, because I don't know what it's like to go to med school, but in chiropractic school, we're basically taught to, like, listen, assess, fix the problem. I know I have the degree, and I have all the expertise and I have all the experience and I've got the equipment. And so this is what's wrong with you. And this is what you need to do to fix it. And if they don't do it, then I don't know, you move on to the next patient. And school wasn't like that. They weren't that. I'm just kind of summarizing, but I imagine that it's similar in medical school. So to step out of that is tough. So how did you come to that kind of conclusion where it's like, okay, I can't just tell people what to do. I've got to meet them halfway.
I do. I think, I'm very appreciative to my med school. I think in a lot of ways it was very progressive into really kind of coming across that way. I had some really incredible mentors that really walked me through what that looked like and how to apply that. I think that's also where my undergrad degree stems from is motivational interviewing and delivering health education that then went seamlessly into med school. But I had a couple of really incredible teachers, and I think that just by practicing, I'm constantly humbled by where I've missed the mark. Whereas, like, for instance, I had this one asthmatic who needed this preventative medicine so that they weren't continuing to have this difficulty breathing. And we were keep on having this trouble. And I was just like, Mom, why can't you give him the medicine? I was so frustrated because we had all of these asthma attacks. I'm clearly frustrated. I had this moment of weakness. I'm like, what is our problem? Why can't we give this medicine? And she goes, he fights me. I am wrestling him and I'm so done with fighting. And I looked and I go, why are you fighting? He goes, because it takes too long. And I go, oh, if I just give it in a different way and you only had to puff as opposed to sit with a nebulizer, will you take it? Yeah, I'll do it. I'm like, oh, I can't believe we were battling this and this was the only problem, but it had taken that long. And it was my failure to ask the right question to see what was the true barrier to getting him the preventative medicine that he needed. And it was just, he didn't want to sit around and with a nebulizer that took, 5 minutes. He wanted to just do one puff and then be done. And yeah, just things like that. And I think the more humbling failures that I have, that helps me to kind of really approach each new problem with humility and openness. And so I think that's a big part of it. I think is just I've been practicing long enough to make enough mistakes that I learned from them.
Well, at your office, you guys build in time too. I feel like just at least when I go with our kids, we have, I don't feel rushed. I feel like we have unlimited time with even multiple providers, which is unusual. I think pediatrics, because we've been to other pediatricians because we didn't always live in Hillsdale, and you still get time, but I always feel like with as many patients as you guys see and as busy as you are, it doesn't really ever feel rushed. Is that something you tried to cultivate, or is that just kind of your personality and how it turned out?
That is good. That's an honor that I'm beaming, because that's good. We never want someone to feel rushed. Sometimes we feel rushed, but we never want patients or their families to feel rushed. I think we end up it's kind of this idea that if we take that few extra moments to educate, to prepare, to kind of create scenarios like what might you come up with, or what might you run across in the next, in the next year, or between now and your next physical exam, then by doing that, we're empowering parents to just be better parents and better caregivers. So I think that there's that. I also am independent. So if I take extra time, then that's on me, and I have the freedom to make that choice, because I'm not really beholden to a bigger corporate body that is expecting my appointments to last a certain amount of time. So I like that independence. So
how do you guys do scheduling then? And this is kind of off topic, but I'm always curious to see, do you just build in that time expecting to take it?
Yeah, I mean, we do. I think we have enough providers too, some really incredible providers that that all have that similar philosophy, and so I think that helps. So wellnesses definitely have a greater, like the way that I do it is, I have a greater time slot for wellnesses. I have a greater time slot for the first time we see a patient. There is some visits that get kind of slotted as a consultation where we'll know that we need more time, or if we're kind of addressing new onset mental health concerns or behavioral concerns, that just takes more time. And so that is one of the things that sometimes requires us to kind of educate patients about, because sometimes you'll have the people that come in and they're like, oh, I'm here for an ear infection, and then you get in there and you're like, and I also have raging anxiety and depression. I'd be like, okay, that's not the same appointment time. So we might have to pivot, but because we have so many incredible providers, that if we miss time slot something, then we can kind of pivot and adjust with the others. So we try to do that as best we can, because a lot of times that just can't wait.
I had been asked by a friend a couple of years ago about how to select, just in general, how do you select a healthcare provider? You know, how do you know, how can you tell, regardless of the specialty, if they're up to date or you're going to get good care? And I think that's an interesting point. If you're, for people listening, ask about how they do scheduling.
Yeah.
You know, is it all the same, or do a lot for different times, for amount of time for different things? Because I've worked in both, working for other chiropractors, and there are, you know, I've been in practices where there's the same amount of time for everybody, and it's not very much.
Yeah.
So if you need more time, you know, I can't give it to you. But there are other practices who build it differently. And for me, a lot of times I would want more time, especially if I'm going to take time out of my day, especially with my kids.
Yeah.
If I have to take time off work, and I've got to go, and I've got one sick kid, and I've got to go pick another one up from school, and I've got to drag them both.
Yeah.
I don't want to be rushed in and out of the office. I'm there. We're here. You know, let's take care of it, and let's answer all the questions and everything. Yeah. So I think that's that's good for people to know if they're looking. Yeah. I mean, you're the only pediatrician, so, but
well, and I say we're really lucky because we have some very understanding families too, because there's some things that I can't account for. I take care of some office emergencies, which not all physicians do. I like the variability of that and helping in kind of stressful situations. So, for instance, like if there's a laceration or kind of a straightforward broken bone, a lot of that we do right in the office, because it ends up being a little less threatening for children to be cared for by someone they know than a busy emergency room. And the emergency room can do it and can do it well, but there's more that kind of comes along with that environment. And so sometimes I do run late, or I get called to an obstetrical emergency with a newborn. And so then that kind of creates delay at the office if I'm kind of doing that. But I have never had backlash or anger. I think everyone that comes to the office knows that I would not cause delay if I didn't have to, and that they know that if their child was the one on the other end of that emergency, that I would be doing the same thing. And so I think we're just really lucky to be in a community that has that level of understanding.
Yeah. I'll share a story. So you remember when we had I think it was last year. Yeah, it was last February. We had bats in our house, and we had a newborn. Cora was, I don't know, maybe a week old.
Yeah.
And there was a bat flying around. And so Marissa freaked out. We went to our in-laws. We were there for a while, and it happened to be during an ice storm also, and our main line water broke. So it was a stressful period. And Cora had an appointment with you, and we came in and we were talking about bats. And you were just like, well, we didn't catch the bat, so we don't know if it has rabies or not. And you're just like, if someone got bit, it's fatal. You know, so you got to do it, you make the decision. So at that point, Marissa was like, you are going right now to the ER, and you're going to see how this is, and you're getting a rabies shot. So we all went through the whole rabies protocol, including our less than a month old child, where like the doses are drastically different. So when I went, I got quite a few shots in the rear end. But for the kids, it's obviously different, and they've got to measure that out. So you tried to keep them out of the ER actually, which was awesome. But that took a lot of coordination. So we were back in wherever we were in the hospital, not in the ER with the kids, and there was some complication with the dosage, or I don't know what was going on. I can't remember that far back, but it was a problem. And the kids were getting restless. Connor had already taken a shot in the rear end, and he was upset. And then we've got this baby. And I remember I think I called your office. You weren't there, or you were doing something else. And I talked to someone at the front desk. And literally within like 90 seconds, I heard your voice on the phone talking to the nurse, straightening it out. So I imagine on that day, I was causing some other parent to wait. But those are the kind of things that I feel like with other doctors in other situations, you might not get that kind of support. But when your pediatrician, who also happens to be the chief of the staff at the hospital, calls and says, "Do it now and do it right. Let's get this done." Well, they got it done, and I don't think it was anyone's fault in particular. It was just a breakdown in communication, but it definitely helped speed things up. Yeah. So, but as you were talking about that, I was like, oh, I was probably one of those cases where like I was making someone else late. But I don't know. I don't think I ever thanked you for that though. We didn't like all the shots, but
that's always miserable. Our family ran not quite as young, but my daughter was 9 months old, and we had a bat in the house, and I learned the hard way that no bat should leave your house alive. Capture the bat.
Yeah, Marissa's still like hypersensitive. If she like thinks she sees a bat outside, close everything.
That's right.
But then I was like, for a while, I think the shot lasts a while, so I don't think we're.
Yeah, it's quite a while. So then you have your like, wow,
so we can.
I'm covered.
So then Connor found out about it, and he still thinks about it. And recently, he was coming up with a plan to hunt the bats, and I was like, that's not. Because I could see him being successful somehow and stunning one, and then picking it up and bringing it inside, and then it flying around.
It's resourceful. Yes.
Yeah. But and then our dog, we have a little dog, and she is weak and timid. So the last time a bat was in the house, she freaked out. She didn't know what it was, so she went and hid under the bed. So I have no support. It would just be me running around the room. Yeah. Well, do you have any closing comments on youth physical fitness? We got off topic a little bit, but I just like talking to you. So it seems like if I want to summarize, it's essential. Physical fitness, physical activity, doesn't have to be formalized exercise, but moving your body frequently, regardless of the effects of on body weight or anything like that, is essential for quality health.
It's good. Yeah, I would say that's it. Parents, please model for your kids. Don't feel overwhelmed by having to do something super formal. Just play outside, play with them, start out small. The social bonding part of it too, if you are playing with your children outside, that will release endorphins and serotonins and all these happy brain chemicals. It will increase the bonding that you have with your children, and then will create a positive response in their brain when it comes to physical activity. Just all around goodness for bonding, goodness for relationships, goodness for their bodies.
All right.
Yeah.
Well, thanks for joining me today. I appreciate it.
Thanks for having me. This is great.